What is Irritable Bowel Syndrome (IBS)? Irritable Bowel Syndrome (IBS) is a long-term chronic condition that affects the digestive system. IBS can affect anyone at any age, but it most often first develops in young adults. For information, women are affected more often than men. The main symptoms of IBS are
stomach pain or cramps. It is usually worse after eating and better after doing a poo. Next is constipation. The person may strain when pooing and feel like cannot empty the bowels fully. Other than that, bloating. The tummy may feel uncomfortably full and swollen. Lastly, diarrhea. The person may have watery poo and sometimes need to poo suddenly.
Epidemiology of gastrointestinal tract for IBS, or known as Irritable Bowel Syndrome. So, what is epidemiology? Epidemiology is the study of distribution of health-related states in population. About 10% population has IBS, and 200 per 100,000 people receive initial diagnosis of IBS over a year. 30% of people who experience symptoms of IBS will consult physician immediately as they have a higher level of anxiety. The most studies show that higher ratio of women who develop IBS compared to men, which is the ratio of 2 to 1. What you have to know about IBS. So there is no association with socioeconomic status. Aggregate within family and genetic are still under review or study. IBS patients likely have other functional disease and have more surgery than general population. There is no evidence shows that IBS associated with increased mortality risk.
Pathogenesis of Irritable Bowel Syndrome. How can we know the development of Irritable Bowel Syndrome? A group of symptoms that occur together, repeated pain in your abdomen and changes in your bowel movements, which may be diarrhea, constipation, or both. Signs of development of IBS. Change gastrointestinal movement, visceral hypersensitivity, post-infectious reactivity, brain-gut interactions, changes in fecal microflora, bacterial overgrowth, food sensitivity, carbohydrate malabsorption, and intestinal inflammation all have been affected in the pathogenesis of IBS. Progression of IBS. IBS can develop after a severe bout of diarrhea, gastroenteritis caused by bacteria or a virus. IBS may also be associated with an excess of bacteria in the intestines, bacterial overgrowth. People exposed to stressful events, especially in childhood, tend to have more symptoms of IBS.
Now let's move on to the diagnosis of IBS. Unfortunately, there is no specific test to definitively diagnose IBS. Your doctor may start with a complete medical history, physical exam, and test to rule out other similar conditions such as celiac disease. Additional tests may include X-ray or CT scan, upper endoscopy, biopsy, stool test, blood test for bacterial overgrowth, blood test, lactose intolerant test, and colonoscopy. After other conditions have been ruled out, your doctor is likely to use one of these sets of diagnostic criteria for IBS. So first, from criteria. These criteria include abnormal pain and discomfort lasting on average at least 1 day a week in the last 3 months, associated with at least 2 of this factor, which is pain and discomfort related to defecation, and the frequency of defecation is altered or stool consistency is altered. Next type of IBS. For the purpose of treatment, IBS can be divided into 3 types based on your symptom, which is IBS-D, IBS-C, IBS-M, or also known as IBS-A, and also IBS-U. Next, let's talk about treatment for IBS. So unfortunately, there's no cure for IBS. Treatment of IBS only focuses on relieving symptoms so that you can live as normally as possible. Based on your symptoms, your doctor might suggest medications such as fiber supplements, laxative, antidiarrheal medication, anticholinergic medication, tricyclic antidepressants, SSRI antidepressants, and pain medication. Your doctor might suggest that you also avoid food that triggers your symptoms, eat high fiber food, drink plenty of fluids, exercise regularly, get enough sleeps, and also eliminate high gas food, gluten, food maps from your diet.
That is all from us. Thank you for watching.